The Johns Hopkins Hospital is the teaching hospital and biomedical research facility of Johns Hopkins School of Medicine, located in Baltimore, Maryland, United States. It was founded using money from a bequest by philanthropist Johns Hopkins. The Johns Hopkins Hospital and the Johns Hopkins School of Medicine are the founding institutions of modern American medicine and are the birthplace of numerous traditions including rounds, residents and housestaff. Many medical specialties were formed at the Johns Hopkins Hospital, including neurosurgery, by Harvey Cushing, cardiac surgery by Alfred Blalock, pediatrics and child psychiatry, by Leo Kanner. The Johns Hopkins Hospital is widely regarded as one of the world's greatest hospitals. It was ranked by U.S. News & World Report as the best overall hospital in America for 21 consecutive years. In 2012 it was briefly supplanted by the Massachusetts General Hospital, but regained the top position in 2013, before moving to third place in 2014. Beginnings. Johns Hopkins, a Baltimore merchant and banker, left an estate of $7 million when he died on Christmas Eve 1873 at the age of 78. In his will, he asked that his fortune be used to found two institutions that would bear his name, Johns Hopkins University, and the Johns Hopkins Hospital. At the time that it was made, Hopkins's gift was the largest philanthropic bequest in the history of the United States. Toward the end of his life, Hopkins selected 12 prominent Baltimoreans to be the trustees for the project and a year before his death, sent a letter telling them that he was giving 13 acres of land, situated in the city of Baltimore, and bounded by Wolfe, Monument, Broadway and Jefferson Streets upon which I desire you to erect a hospital. He wished for a hospital, which shall, in construction and arrangement, compare favorably with any other institution of like character in this country or in Europe, and directed his trustees to secure for the service of the hospital, physicians and surgeons of the highest character and greatest skill. Most importantly, Hopkins told the trustees to bear constantly in mind that it is my wish and purpose that the hospital shall ultimately form a part of the medical school of that university for which I have made ample provision in my will. By calling for this integral relationship between patient care, as embodied in the hospital, and teaching and research, as embodied in the university, Hopkins laid the groundwork for a revolution in American medicine. Johns Hopkins' vision, of two institutions in which the practice of medicine would be wedded to medical research and medical education was nothing short of revolutionary. Initial plans for the hospital were drafted by surgeon John Shaw Billings, and the architecture designed by John Rudolph Nancy and completed by Edward Clark Cabot of the Boston firm of Cabot and Chandler in a Queen Anne style. When completed in 1889 at a cost of $2,050,000, the hospital included what was then state-of-the-art concepts in heating and ventilation to check the spread of disease. The trustees obtained the services of 4 outstanding physicians, known as the Big Four, to serve as the founding staff of the hospital when it opened on May 7, 1889. They were pathologist William Henry Welch, surgeon William Stewart Halstead, internist William Osler, and male gynecologist Howard Atwood Kelly. In 1893, Johns Hopkins University was one of the first medical schools to admit women. The decision to begin co-education was a result of a shortage of funds, as the B&O railroad stock that was supposed to cover cost was used up in building the hospital in 1889 and the medical school had not yet been built. 4 of the original trustees unregistered trademark daughters offered to raise the money needed to open the school, but only if the school agreed to admit qualified women to the university. After several discussions the trustees agreed to their terms and accepted the financial help of these 4 women, with only one of Drs. William Henry Welch resisting. Eventually even Welch changed his views on co-education. The necessity for co-education in some form, he wrote later, becomes more evident the higher the character of the education. In no form of education is this more evident than in that of medicine. We regard co-education a success. Those of us who were not enthusiastic at the beginning are now sympathetic and friendly. Osler, the first chief of the Department of Medicine, is credited with originating the idea of a residency, whereby recently graduated doctors receive advanced training in their specialty while treating patients under supervision. Then as now, Residents comprise most of the medical staff of the hospital. He also introduced the idea of bringing medical students into actual patient care early in their training. At the time, medical school consisted almost entirely of lectures. Oslo's contribution to practical education extends to the creation of grand rounds, the practice of leading physicians discussing the most difficult cases in front of assembled medical students, for the benefit of patients and students. He once said he hoped his tombstone would say only, "He brought medical students into the wards for bedside teaching." Halsted, the first chief of the Department of Surgery, established many other medical and surgical achievements at Johns Hopkins, including modern surgical principles of control of bleeding, accurate anatomical dissection, complete sterility, and the first radical mastectomy for breast cancer. His other achievements included the introduction of the surgical glove and advances in thyroid, biliary tree, hernia, intestinal and arterial aneurysm surgeries. Halsted also established the first formal surgical residency training program in the United States. Kelly is credited with establishing gynecology as a true specialty. He created new surgical approaches to women's diseases and invented numerous medical devices, including a urinary cystoscope. He was one of the first to use radium to treat cancer. Welch was responsible for training many of the outstanding physicians of the day, such as Walter Reed. He also founded at Hopkins the nation's first school of public health. In 1912, Diamond Jim Brady donated $220,000 to the hospital, which created the James Buchanan Brady Urological Institute. Ophthalmologist William Holland Wilmer opened the Wilmer Eye Institute in 1925, its home was completed 4 years later. Dr. Wilmer received an MD degree from the University of Virginia in 1885 and worked in New York, Washington, D.C., in addition to Baltimore, where he established the institute. Achievements. Medical achievements at Johns Hopkins include the first male-to-female sex reassignment surgery in the United States that took place in 1966 at the Hopkins Gender Identity Clinic. Two of the most far-reaching advances in medicine during the last 25 years were also made at Hopkins. First, the Nobel Prize-winning discovery of restriction enzymes gave birth to the genetic engineering industry. Second, the discovery of the brain's natural opiates has triggered an explosion of interest in neurotransmitter pathways and functions. Other accomplishments include the development of HeLa, by George Otto Gay, head of tissue culture research in 1951. The first and arguably most important line of human cells grown in culture. Identification of the 3 types of poliovirus. And the first blue baby operation, which was done by surgeon Alfred Blalock in collaboration with Helen Taussig, a female Hopkins graduate specializing in pediatric cardiology, and surgical technician Vivian Thomas, which opened the way to modern heart surgery. Operations. The hospital occupies approximately 20 of the 60 buildings on the Johns Hopkins Medical Campus. The complex has over 80 entrances and receives 80,000 visitors weekly. It houses over 1,000 beds and has a staff of over 1,700 doctors with over 30,000 total employees. In May 2012, the Johns Hopkins Hospital opened 2 new towers as part of a major campus redevelopment effort. The opening of the new $1.1 billion Charlotte A. Bloomberg Childrena Euro unregistered trademark S Center Tower and the new Sheikh Zayed Tower marked the high point of this effort. In addition to the main hospital, the system operates 4 other hospitals and several outpatient care facilities in the Baltimore and Washington metro areas and a children's hospital in St. Petersburg, Florida. Rankings. The Johns Hopkins Hospital was ranked as the top overall hospital in the United States for 21 consecutive years by U.S. News & World Report until 2012, when it moved to second place behind the rise of the Massachusetts General Hospital. In 2013, it was reinstated as the top hospital in the United States. A plan for the future of Johns Hopkins Medicine. Johns Hopkins Medicine developed a 5-year strategic plan to lead the change. The plan guides our business strategies and decisions with a focus on 6 strategic priorities in which we unregistered trademark LL invest our time and resources to people, biomedical discovery, patient and family-centered care, education, integration and performance. These 6 priorities are critical areas of focus for the success and sustainability of the institution. The strategic priorities and overall structure of the plan were developed during an 18-month process led by a diverse, multidisciplinary coalition of faculty and staff leaders representing all member organizations and a host of roles throughout JHM. Dean/CEO of Johns Hopkins Medicine. Paul B. Rothman, MD, Dean of the Medical Faculty, Chief Executive Officer of Johns Hopkins Medicine. Paul B. Rothman is the Francis Watt Baker, MD, and Lennox D. Baker Jr., MD, Dean of the Medical Faculty, Vice President for Medicine of the Johns Hopkins University, and CEO of Johns Hopkins Medicine. He is the 14th Dean of the School of Medicine and the 2nd CEO of Johns Hopkins Medicine. As Dean/CEO, Rothman oversees both the Johns Hopkins Health System and the School of Medicine. A rheumatologist and molecular immunologist, he came to Hopkins in July 2012 after having served as Dean of the Carver College of Medicine at the University of Iowa and leader of its clinical practice plans since 2008. Previously, he served as head of internal medicine at the University of Iowa, beginning in 2004, and prior to that as vice chairman for research and founding director of the Division of Pulmonary, Allergy and Critical Care Medicine at Columbia University College of Physicians and Surgeons, where he joined the faculty in 1986. A 1985 Beta Kappa graduate of the Massachusetts Institute of Technology, Rothman earned his medical degree from Yale University in 1984. He then trained at Columbia Presbyterian Medical Center and accepted a postdoctoral fellowship at Columbia University prior to joining its medical school faculty. Rothman's research focused on immune system molecules known as cytokines. Specifically, he investigated the role these molecules play in the normal development of blood cells, as well as the abnormal development of these blood cells that leads to leukemia. He also studied the role of cytokines in immune system responses to asthma and allergies. His work was consistently funded by the National Institutes of Health. His honors include a James S. McDonnell Foundation Career Development Award, a Pfizer Scholars Award, a Pew Scholar Award, a Leukemia Society of America Scholar Award and the Pharmacia Allergy Research Foundation International Award in 1997. Dr. Rothman is a member of the American Society for Clinical Investigation and is a Fellow of the American College of Physicians. He was elected to the Council of Association of American Physicians, as a Fellow of the American Association for the Advancement of Sciences and as a member of the American Clinical and Climatological Association. See also: Johns Hopkins University, Johns Hopkins University School of Medicine, Hopkins television series, Medical Centers in the United States, references. Further reading: Roberts, C.S. H. L. Mencken and the Four Doctors, Osler, Halstead, Welch and Kelly. Baylor University Medical Center Proceedings 23, 377 €88. PMCA 2,943,453. PMIDA 20,944,761. External links: the Johns Hopkins Hospital and Health System website, Johns Hopkins Medicine website, Baltimore, Maryland, a National Park Service Discover Our Shared Heritage travel itinerary, Johns Hopkins Hospital on Google Street View, C-SPAN Q&A interview with Ronald Peterson about Johns Hopkins Hospital, January 9, 2005.